Done an en bloc on a patient who is only 24, 5/16/23 en bloc, initials LT. Now what's interesting is she had a surgery done in 2019, just 4 years ago, and she had what is a grade 4 contracture on the right and also a grade 4 contracture on the left. And as you will see, people ask me, the patients, what is a capsular contracture? The implants, they all form capsules, just like any foreign body inside the human body. And there's 4 classifications, or what they call the Baker's grade classifications. So our patient has the grade 4. She has a deformed breast that is painful. So this is very important, the painful part. This is what makes it a grade 4. And she had pain at rest on the right and also on the left, and the implant is palpable and visible. From a distance you can see that it's riding up and it's visible. Versus grade 3 is pretty much similar to grade 4, where it's hardened but not painful. That's why it's a 3. And the implant is palpable and visible. So the painful differentiates between the 3 and 4. Number 1 is normal. Breast is soft, implant is not palpable and not visible. Now 2 is where the breast is solid, like a little bit hard but not soft, and the implant is palpable but not visible. So in this case, our patient had this, and she was in a lot of pain and a lot of misery, and so hence her desire for what is removal of implants that she just got, in 2019. Now if you look at this, how is compressed together, and you can see I removed that excess tissue that was on the side, also over here, and you can see how this capsule, it's thin, and how it compresses and basically compresses the implant so hard under so much pressure. So what I'm going to do is I'm going to flip this around, and I'm going to go ahead and cut this off over here, and let's see what this shows. As you can see, look at these bubbles. This, if you touch, does not look and feel fine. You can see the scar tissue up at the out. So I wanted to incorporate this. So as I go in, let's go ahead and see. Remember, this is very hard, right? This is compressing the implant, and you can imagine if this is sitting against the breast tissue and the nerves of the chest, causing the patient a lot of misery. So let me go in. I'm going to go in a little bit slow. Let me find another better access over here. So minimal blood loss, as you can see. I'm going to go in here. See how thin this is? So I've heard this from the many phone consultations that I've done. The surgeon said they could not remove the capsule because it was so thin. Now this is super thin. You can see, look at my instrument, right? No matter what, the capsule must be and can be and has to be removed. That's the whole essence of explant surgery. If you leave the capsule behind, you're leaving the burden behind. And so you can see, look how thin this is, right? And so the whole capsule needs to go, and this is, look at the way the implant was sitting. So as you can see, right, I'm just going to try to preserve it in the manner that it was. So it was like suffocating and holding the implant together. So as I let go, you'll see the implant is going to assume its shape, and you can see how this crevice has formed where this was. Now the implant is very much intact. None of this fluid leaked out. This is an intact implant. This is your Allergan 345 intact silicone implant. And let's look at the capsule. Super ultra thin. And again, as you have seen me do this, no matter how thin the capsule, the entire capsule must be removed. That's the whole etiquette of what is. You see how thin this is? The entire capsule must be removed. And as you can see, we'll see what the pathologist says. And all of it was released very nicely with minimal blood loss. Now what I'm going to do is I'm going to change my gloves. And again, you can focus on the grade 4 types of capsular contracture. You can have grade 4 on one and grade 1 on the other side, so it doesn't have to be, and you'll see some patients present exactly like that. So one side may be, and we do not know why this forms majority of the time, why there is capsular contracture. There is theories about bacterial contamination slash size of the implant, the reaction. So what I'm going to do here is, again, I cut out the excess skin. That really helps with the aesthetic contour. And you can see, look at the pointed nature and how you see how it has folded up on itself. And what I'm going to do next is I am going to go in from here. Again, this looks like an intact Allergan implant 2. But she had this contracture that was giving her a lot of misery. She couldn't wait. She worked very hard and made a lot of effort to come in her surgery. I couldn't be happier. We did exactly without the drains, without any lift. And over here, this is again just fluid. You can see, now this is what I want to show. Look, you saw some fluid, right? This is your gel bleed that's occurring. And again, just a reminder, Dr. Henry Dykman, you can see how this fold on Dr. Henry Dykman is going to talk about, we're going to do a Facebook Live tomorrow. 345 Allergan, Dr. Henry Dykman is going to do a Facebook Live tomorrow in regards to, you know, his research that he's presented. And again, you can see some areas relatively thin, some areas relatively thick. And so I'm very happy with how the whole dissection was done. Again, minimal, very thin capsule. So implants are always, so this is the con procedure. This is how I do it. The implants are always returned to the patient, be it saline or silicone, so that the patient has mental closure that this is what was removed. Number 2, capsules always sent to pathology, rule out the BIAL, CL, CD30 analysis. Number 3, cultures for aerobic, anaerobic, and fungal sent to microbiology lab to rule out the infections, fungal infections, bacterial infections. No time, no need for a lift, especially in a young patient like 24-year-old patient. No need for drains. This is clearly the blood loss was essentially minimal, maybe 3 cc's each side. The next one is twilight sedation. The patient is comfortably breathing on her own in twilight. To date, not a single patient has recalled or been awake. This is where she's completely amnestic to the event. And the same, I take pictures for the high definition pictures and videos showing complete removal of the whole capsule. And then the 8th point is all patients get the same surgery regardless of age. I did a 70-year-old patient right before her. She got the same surgery that this nice 24-year-old patient got, regardless of the extremes of age, comorbidities, issues. The goal is simple: remove the entire implant capsule, all implant tissue, and to send it to pathology and do it in the manner that I've done. And I've done so many of these persistently. As you heard, I presented at the international conference, and this is where I feel strongly this is how it needs to be done. And post-op, when we look back, we have done a complete detailed analysis as to what the tissue was and what it was not, and cultures are done, and the patient is free and void. The patient has freedom of that peace of mind that all of that capsule was removed, because that is the whole essence of explant surgery. This is Dr. Khan, Executive Plastic Surgery.